Whenever you want.
Our next speaker is Alli. Throughout the quarter, we have heard Alli speak on the topics of healthcare in third world countries and about her piano teacher. We have also learned that her handwriting is hardly legible and that she thinks it is a good idea to have Save or Splash for the underclassmen. Alli first became interested in schizophrenia when she watched a movie called The Beautiful Mind in 7th grade. The class Personality Development further sparked Alli's interest in the brain disorder. So ladies and gentlemen, please welcome Alli Johnson.
What do an influential artist, a president's wife, a professional football player, a Nobel Prize winner, a Beach Boy, and a Broadway starlet have in common? Even these people of such high regard and influence have suffered from schizophrenia. Artist Vincent van Gogh, Nobel Prize winner and renowned mathematician John Nash, Lionel Eldridge, former Packer, and First Lady Mary Todd Lincoln are a few of the 1% of the population that has been diagnosed with schizophrenia, according to WebMD, updated 2013. Schizophrenia is a complex and chronic psychiatric disorder. We will discuss 3 main types of schizophrenia, as well as its causes and the effects it has on the brain. Paranoid schizophrenia is the most widely known type. Symptoms of paranoid schizophrenia disrupt the patient's daily life. As stated by Mayo Clinic's website, updated 2013, symptoms of paranoid schizophrenia may include auditory hallucinations, paranoid delusions, anger, anxiety, violent behaviors, and emotional distance. Delusions and hallucinations make paranoid schizophrenia the most distinct and therefore the most commonly known type. These auditory hallucinations are prevalent, and to the patient they are completely real. The voices they hear may be telling them negative things and may cause them to harm themselves or others. Common delusions include the patient thinking they are being singled out to be harmed. As stated by Medical News Today, a website that reports hourly health news from well-regarded sources, updated 2013, stated that when someone shows signs of these symptoms, they must meet the qualifications set by the American Psychiatric Association before they can be officially declared paranoid schizophrenic. The criteria for paranoid schizophrenia include an obsession with a specific delusion and recurrent auditory hallucinations. Disorganized schizophrenia is another type. There are distinct symptoms that set it apart from the other types. These symptoms may include disorganized thinking and behavior and absent or inappropriate emotional responses. Due to unorganized thought patterns, communication is very difficult. Schizophrenic.com, updated 2013, a website dedicated to spreading awareness and support for schizophrenia, stated that other behaviors may include actions that not make sense in context. For example, acting silly or laughing during a serious situation, and the inability to finish a goal-oriented task, or even one as simple as showering. A large question with any type of schizophrenia is, does the patient know they are schizophrenic? Schizophrenia.com stated that anosognosia is the lack of insight and recognition of an illness, and it affects as many as half of schizophrenics. It may be prevalent in disorganized schizophrenics because of its particular symptoms, which may seem like something that everyone goes through, but in reality, their symptoms are much more severe. The third and rarest type of schizophrenia is catatonic schizophrenia. WebMD states that catatonic schizophrenia is characterized by strange movements. This may include a complete lack of movement, constant bizarre movements, or strange stature. It also involves strange speech patterns, including lack of speech or incessant repetition. Diagnosing catatonic schizophrenia requires some specific criteria. According to schizophrenia.com, at least one of the following symptoms must be prevalent. The patient is unresponsive and immobile. The patient has excessive meaningless movements. The patient refuses to move and may refuse to speak. The patient takes strange facial postures or positions. Or the patient repeats or imitates movements and sounds around them. All of these types of schizophrenia have similar effects on the brain. Causes of schizophrenia are also identical. In VegasSystema.com, the website for schizophrenia medication Invega Sustenna, updated May 2013, states that studies show chemical imbalances in the brain, as well as genetic factors, may be the primary cause of schizophrenia. According to WebMD, genetics play a large role in schizophrenia. Schizophrenia occurs in about 1% of people, but that number increases to 10% when an immediate family member has the disease, and up to 40 to 65% when that family member is an identical twin. WebMD also states that brain structure and chemistry may cause schizophrenia. Imbalances in neurotransmitters in different brain structure may lead to more or less activity in certain parts of the brain. These are brain scans of 2 identical twins, one without schizophrenia and one with. You can clearly see that, especially here, in some parts here and around here, that there's noticeably less gray matter and less activity in those parts of the brain, which may be the cause of schizophrenia in that twin. The aforementioned also stated that environmental factors play a large role. Fetal distress, marijuana and drug use, and other factors have been proven to cause or worsen effects of schizophrenia. We have covered the three main types of schizophrenia, as well as its general causes and its effects on the brain. I hope this has given you all a new understanding and respect for schizophrenia and its patients.